Hi everyone. My name is Faith Okungu, and I'm going to do a presentation on GABA neurotransmitter. I'm going to share my screen. See. All right, here we go. So, GABA, gamma aminobutyric acid, is one of the main inhibitory neurotransmitters found in the central nervous system. Its functions include promoting sleep and relaxation, reducing brain stimulation, overstimulation, thereby reducing anxiety episodes and regulating motor and muscle movements. It functions by blocking signals between neurons. It prohibits neurons from firing the action potentials, and this helps to balance excitatory signals that may cause overstimulation in the brain. And that is my image. Two associated receptors include one, inotropic receptors, which include chloride channels. Now, when GABA binds, chloride ions enter the neuron, cause hyperpolarization, making it less likely to fire. So these receptors mediate a rapid inhibitory neurotransmission. Second receptor is a metabotropic G protein coupled receptors that modulate potassium and calcium channels indirectly, producing a slower, longer lasting inhibitory effect in neurons. One psychiatric deficit diagnosis associated with a deficit of GABA is the GAD, generalized anxiety disorder. Persons with generalized anxiety disorders often have a reduced GABA levels in the brain, particularly in the regions of the prefrontal cortex and the amygdala. Now, these areas of the brain are usually responsible for fear and stress regulation, and the deficit of GABA causes them to have generalized anxiety disorders. Low GABA activity impairs the brain's ability to inhibit overreactive neural circuits, contributing to persistent worry and tension, which are signs, symptoms of generalized anxiety disorder. One psychiatric diagnosis with a surplus of GABA is ASD, autism spectrum disorder. Now, autism spectrum disorder is a neurodevelopmental disorder which is characterized by behavioral and social impairment. So when GABA is surplus in the nervous system, patients with ASD usually experience hyperactivity and mostly children or even adults to a certain level have concentration issues. And usually this is seen per research that low GABA concentrations in the sensorimotor cortex of the brain and GABA concentrations, lack of it positively correlate with the self-reported hypersensitivity in adults with ASD, causing them to have the social impairments, speech delays, sometimes of speech delays and, lack of social interactions. All right. One drug that is associated or that increases the effect of GABA includes benzodiazepams, such as Ativan. The other name is lorazepam. And what this medication does, it enhances the effects of GABA by acting as positive allosteric modulators on GABA A receptors. This means that they bind to a specific site of the receptor, increasing its affinity for GABA, which in turn enhances the inhibitory effect of GABA in the brain. One medication that reduces the effect of GABA is flumazenol, also called romoxicon from the antidote class. This medication is usually used to reverse the side effects or the effects of benzodiazepines, especially from people who overdosed from the medication. So it reverses the sedative effects that benzodiazepine causes by creating an inhibitory effect on the GABA neurotransmitter. Thank you, everyone. I hope you enjoyed my video.